Makers of healthcare devices and New Heights Pharma together to enlighten the public on the importance of knowing their health numbers, particularly blood pressure readings.
And many people are not aware of this. So we have a lot to do in terms of education. We want to help. That's why we're so focused to help doctors, nurses and pharmacists to help and train them to educate people. Because it's we call it the silent killer. You do not know that you have a high blood pressure until it hits you.
One, healthcare system, we know infrastructurally we have challenges. Resource, we have challenges. The second thing is that we know also that stroke and cardiovascular incidents are the #1 killer in Nigeria, especially amongst adults. And so it's very important that the media, but also as well as we, take more responsibility.
Knowledge is power, so the saying goes. The Omron New Heights Pharma Partnership is looking to put that power in the hands of individuals to be able to regularly check their blood pressure levels with Omron kits and seek medical treatment where needed.
Hypertension is a serious matter in blacks, and Nigeria is the most populated country with blacks living in it. Now when you put all of those factors into consideration and then add the fact that our healthcare system is not exactly what it should be, and the level of ignorance in our society, then you understand why this is very important. And so our coming into the business as partnering with Omron is to also make sure that this product is found in the hands of every Nigerian that needs it.
Blood pressure measurement you can do at home and then consult a doctor if there's a deviation on your values. Omron is all about quality, accuracy, and also durability. And why I say that is that in our process we always want to maintain a high level of quality. Because we do believe that, especially when you talk about medical products, you cannot sacrifice in any terms the accuracy to the measurement a patient would do.
Nobody really should have an excuse not to own a blood pressure monitor in Nigeria. Once you are above a particular age, whether you are hypertensive or not, it is just good for you to have something that you use to keep your health indices and parameters in the right numbers. So we have this number that says know your numbers. It's part of what we promote. Everybody should know their numbers. So the price is such that everybody can fit in at one point or the other.
We also recognize that there will be people who cannot afford our products. And so what's important here is that we are also empowering pharmacies to also have the apparatus that we provide. So they can also offer free checks in the neighborhoods, or perhaps at a very minimal rate, 100 naira or so that they, because they cannot afford it, they still are not denied access.
Preventing hypertension is also key.
But on the prevention part, and that starts on all ages, there are also more to do. So definitely in terms of, you already mentioned, like salt intake. That's a big issue, creates hypertension. So just already reducing the amount of salt intake that people take definitely will help. More movement, people being more active does also help. So the awareness creation is not only measure blood pressure, but also what can you do indeed to live a healthier life. And that has to do with especially nutrition and also be active and do sport activities.
The management of New Heights Pharma says the company is at the forefront of making sure that Omron range of products, which include blood pressure devices, respiratory kits such as nebulizer, and other Omron devices to improve health, get into the hands of most Nigerians.
Welcome back. We're still talking hemophilia. It's blood today. And you can call in now. The number to call is 0808-054-2233. That's 0808-054-2233. Doctor, I was going to ask you. Boys are the people we circumcise.
Yes.
So what happens if a boy with, hemophilia is born and then he's circumcised? There's always a bit of blood at the procedure. Is that dangerous?
Very dangerous. Okay, if most boys in our environment, that is where the first major problem comes in. Okay, circumcision is cutting, right? The child will bleed, right? So when you see a child that after circumcision, after they've taken the normal processes to try and control the bleeding doesn't stop.
When should a mother be concerned? How long is the bleeding supposed to continue for and, stop? What's the normal clotting time?
Clotting time is different from the bleed of hemophilia. Clotting time, normally within 10 minutes, it stops. But during circumcision, after circumcision, especially when you use the modern method of the bells,
yes.
okay, there should be very, very minimal bleeding. Just the small stains that should not be there. But you pack, it gets soaked, they change the gauze, they put another one, it gets soaked again. That is excessive bleeding. Okay. As soon as possible, they should get to a higher level of medical care. All right. So circumcision is one, because boys get circumcised in this our environment, is one first time of one first procedure that exposes the boy to a major bleed.
Okay, that is a very good point. I think it's very easy to discover, but why take the risk? Shouldn't they know before that time that this could happen and be ready for it?
Especially if you have a family history. Okay, it runs in the family. Okay, you have someone in the family down the line that bled excessively after circumcision. I mean, the story gets carried on. In fact, you have little boys that die at circumcision. Okay, so we hear stories about in this family they usually die at circumcision. Okay, and
they don't know the reason.
Some even attribute some other causes, other reasons for that.
We have a call coming through.
Okay.
Ife Sinachi, hello.
Good morning.
Good morning. Can we have your question?
Please, doctor, we want you to assist us. I bleed so fast.
What do you mean by fast?
My heart beats fast.
I don't think that's in the scope of this discussion.
Oh, well, I think if you have fast heartbeat, okay, I think you should see your doctor as soon as possible. It is not normal.
But that is not connected with
hemophilia. No, absolutely.
But you should say, doctor, if you feel your heart is beating too fast.
Anything that is not normal about your body, you should not even be aware that your heart is beating.
Okay, that's a good one.
Yes,
you shouldn't be aware. So the minute you get aware, you should be concerned.
At rest. And you now you notice your heart is beating. Okay, or you take a flight of stairs and you can hardly breathe, or your heart is pounding. You should see a doctor as soon as possible.
Okay, is it only through the genes that one can get hemophilia? There's no chance of getting it if your parents don't have it, or your mother doesn't have it?
Yes, it's possible.
It's possible?
Yeah, it's possible. There's some that have what we call acquired hemophilia.
How do you acquire
hemophilia? They are born normal, they have normal genes. They just have maybe a disease condition, for instance, like what we call autoimmune conditions, that their body now forms antibodies, like soldiers, to attack those clotting factors. So his body is producing normal clotting factor, but at the same time producing other things that are taking away those clotting factors. So it will present just like
so it's an attack on the body?
By the body itself.
We're having a call from Lida, Kwara State. Hello, Lida. Hello, Lida. Are you there? We lost that call. So you were saying that an immune reaction that attacks the clotting factors.
Yes. So you present just like hemophilia.
But I hope that's rare.
Well, it's not very common, but it can be part of other diseases like SLE, like other autoimmune
What's
diseases.
SLE?
That's systemic lupus erythematosus.
Okay, we're not going there.
We're not talking about that.
We are not going there. All right, so it's possible, but very rare.
Yes.
That's very nice to hear. And if, for example, you've talked about both parents being affected, that can affect the girl.
Yeah,
but usually if both parents are not affected, it's the boy who gets it.
Yes.
Most times it's the boy who gets it. So boys, watch out. What treatment is given for hemophilia? First of all, is there a cure?
There's no cure for hemophilia. but it's very manageable.
Manageable.
Okay? It's simple. The clotting factor that is deficient is replaced.
Is it, do you get this clotting factor from someone else, or is it manufactured?
Okay, yeah, you can get the clotting factor from another person that is normal, that doesn't have hemophilia, okay? But now the world has moved beyond that. So we now have what we call recombinant clotting factors.
Does that mean made in the lab?
Yes, made in the lab, okay, using genetic engineering and all that, because it's safer. The risk of transfusion infections is less.
An immune response?
It's less also. So you have recombinant clotting factors now that are commercially available. So for us here, what we still do is when the child bleeds, we replace the clotting factor. But in the modern
clotting
world,
factor only?
Yes.
The child does not require a transfusion?
Unless he has bled so much. Okay. If he has bled so much, he may have to give blood to replace the blood he has lost.
Let's see if we can get Elijah from Benin. Hello, Elijah. Are you there?
Yes, I'm the mother.
Good day to you. Can we have your question?
Okay, please. I would like. How would I know a good doctor?
A good doctor for what?
A good doctor about edge, that's chest pain.
Did you get that?
No, I didn't.
Can you be a bit clearer?
Yes, I mean, how would I know as a good doctor? Or sometimes when you meet a doctor for a problem, you'll be sufficient about. When you went to a doctor for a chest problem, he will tell you the actual problem or how to avoid it. But you just ask first, you also how to make money for his own company. How will I know? Sometimes it scares me to go back to that doctor. How will I know a good doctor?
Okay, thank you very much for that question. I think this is bordering on ethics and should I call it a bedside manner or practice manner? He's talking about how the communication between doctors and their patients, that's what he means by a good doctor, I guess.
Well, we do have such problems where I think in Nigeria.
What do we do to stop this?
We just keep educating ourselves, right? You need to. We are used to being just tell the patient just as little as possible. Okay, go and get this drug, and that's all. But as patients also, you should ask questions.
All right.
Yes.
So you should ask questions as a patient. We can't take any more. We've run out of time. Thank you so much for coming. Okay. Thanks for being there for us, all my callers and listeners and tweeters. Thank you for being with us. Let's make it a date another time. I'm Mary Alale Yusuf. Have a great day.